Penile enlargement surgery. Have you ever heard of it? But does it really exist? Is it possible to elongate the penis? Folks, unfortunately, the answer is no. I'm sorry to disappoint many people who seek this type of procedure, but stick with me until the end of this video, as I will explain why it's wrong and there's currently no effective way to talk about penile elongation. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. In today's video, I brought up a controversial topic, penile enlargement surgery. Let's understand what it's about, how it's marketed, and why it's wrong to use this term. This is a highly debated topic on the internet and frequently asked about in medical offices. Some time ago, a singer underwent one of these procedures, which promised penile elongation and enlargement. Many patients inquire in medical offices if this is indeed possible. Well, before we delve into surgical definitions, let's understand the anatomy of the penis. The penis is a cylindrical organ formed by structures that assist both in erection and in urination. For urination, we have the urethra and the spongy body surrounding it. The structures that assist in erection are the corpora cavernosa. These are two cylindrical structures rich in blood vessels, highly irrigated, which facilitate vasodilation and blood flow, resulting in penile erection and rigidity. So folks, to discuss penile enlargement, we would necessarily have to elongate or alter these cylindrical structures that are the corpora cavernosa, which actually provide dimension and increase penile volume during erection. The corpora cavernosa, filled with blood, are what contribute to the size of the penis. Currently, we don't have any procedure capable of modifying or enlarging the corpora cavernosa, so it doesn't make sense to talk about penile enlargement surgery. There are some procedures that help to externalize these structures to better reveal what is sometimes hidden by other body structures. I'll explain more about this later on. It's very common for patients to arrive at clinics questioning these procedures. In fact, there are some techniques widely spread nowadays. But as I mentioned, these techniques will better externalize the corpora cavernosa, those structures of the penis that contribute to erection. I'll quickly mention two of them, which are the most used and propagated by some professionals who offer this type of procedure. One of them is related to the suspensory ligament of the penis, releasing the ligament. Actually, folks, what patients need to bear in mind is that no structure in our body is inefficient or without function. The suspensory ligament of the penis has a function, as defined by its name. So, the surgery for externalization, to better present the penile shaft, involves the release of this ligament. Most patients, perhaps all of them, develop instability of the penis during erection because this ligament provides stability, regularity to the penis when erect, and when this ligament is compromised, the patient loses this stability. The other procedure that patients also inquire about is pubic liposuction. Many patients have a more buried penis due to the presence of fat in the pubic region. So sometimes what is offered is liposuction of this area, with the aim of showing more, of externalizing the penile shaft more. To reinforce, this procedure does not change the length, but the patient has the impression, and indeed, their shaft after pubic liposuction will be more presentable. Today, some other procedures are marketed as penile enlargement, besides the two I mentioned. But it's very important for the patient to be aware that the results are not efficient, not effective. As I said, these are not procedures with a level of evidence or recommendation. The good news is that most patients who visit clinics with the goal of undergoing this penile enlargement surgery actually don't need it. They don't have any problems, and their penis is normal in size, function, and anatomy. Just to add before finishing the video, these procedures that offer penile enlargement and elongation are different from thickening procedures. Nowadays, we see thickening procedures widely advertised, and there are even some urologists performing thickening procedures using injectables like hyaluronic acid. That's another thing entirely. Thickening is indeed possible, and some urologists are already doing it. The patient can undergo this type of procedure as long as they talk to their urologist, align their expectations so that, in the end, the result meets their expectations. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.